Welcome to this week's podcast. I'm Teri Hart. For over 7 months, we have been talking about caregiving, and today we do a deep dive into the second National Caregiving Report, Caring in Canada, with Executive Director of the Canadian Centre for Caregiving Excellence, Liv Mendelsohn. Spoiler alert, it's time to sound the alarm. Hi, and welcome to the Heart of It All, a podcast all about the realities of caregiving. One of the reasons I started this podcast was because every person I spoke to about my caregiving journey had a story of their own. The second I opened up, they did too. And if it wasn't their own story, it was a friend or another family member. The impact of the caregiving crisis is just beginning to be understood, and the numbers for the future tell us we need to find a better solution. The Canadian Centre for Caregiving Excellence recently published Caring in Canada, a survey of over 2,600 caregivers and care providers. Liv Mendelsohn is the Executive Director of the Canadian Centre for Caregiving Excellence, a program of the Azrieli Foundation. Liv strengthens the systems and communities that support caregivers and care providers across Canada through research, innovation, policy engagement, and co-design grounded in lived experience. A lifelong caregiver with lived experience of disability, she is committed to building a Canada where caregiving is valued and caregivers' voices shape programs, policy, and decision making. Liv is here to talk about the survey's findings. Thanks so much for being here on the Heart of It All.
Thank you for having me. I can't wait to dive in.
So let's start. I think it's actually really important, a good starting point. What do you define a caregiver as in the context of this study?
Language is actually really important here. And let me start by saying most people don't identify with that term caregiver. Most people think of themselves, as I do, as a daughter, as a granddaughter, a sister, a spouse. I know my dad, who I care for, wouldn't love hearing me refer to him as his caregiver. But we need to wrap our arms around that word because that, is what makes us visible in policy and visible in really a national conversation. So for us, caregiving, caregiver, that term means an unpaid friend, family, or neighbor caring for someone with a disability, caring for someone who's ill, someone who has needs related to aging. We know that caregivers often don't identify as caregivers until they've hit a barrier or burnout and they realize, oh my gosh, what I'm doing that I just see as part of my daily life and part of my family is actually a thing. It has a name and I need help. I can't do this alone.
So you also include in the survey care providers.
Yes.
Break that out for me. What is a care provider versus a caregiver?
Right. So at our center, it's really important for us to take a holistic look at care. And so we talk not just about those unpaid chosen family caregivers, but also the care provider workforce. So paid personal support workers, disability support professionals, home care workers, those people doing that front line, often very intimate, very necessary, and actually very skilled work as their vocation and profession, who are caregivers, again, professionally.
So when you start out with this need for this study, why is it important for the definitions, Liv? Why do we need to identify what a caregiver actually is and what a care provider actually is?
If we're going to talk about what caregivers do and what care providers do and how they hold up our economy, our healthcare system, we have to agree on what we're talking about and we have to make the invisible visible. We have to be able to say, okay, how many caregivers are there? How many care providers are there? Where are the gaps? And what are they doing? How many hours a day? What are they saving our healthcare system? If we don't name it, we can't measure it. And if we can't measure it, we can't get the policy responses we need to support it. So being able to put it on the map is so important. And it's a big piece of why we do the Caring in Canada survey.
So, who are the caregivers in Canada, and why do you think that this huge aspect of millions of people's lives have not been identified as being part of our healthcare system?
Really important question. And I think until fairly recently, not a question that was asked. So, caregivers, it won't surprise you that caregiving hits every Canadian family. A quarter of Canadian adults are caregiving. Again, for a senior, for someone with a disability, for someone with an illness. So it's really every Canadian family that is involved in caregiving. And again, I don't think this will surprise you, Teri, with your own experience. Half of Canadian women are caregiving right now. So it is a gendered issue. And with our changing demographics, we know that actually all of us will be caregiving. It'll soon be half of every Canadian adult, man, woman, etc. So it's a very universal issue in this country. We're a nation of caregivers.
How do you think, up until recently, because we have not been asking these questions, how do you think it has been viewed? Is it just the responsibility? And if it has just been the responsibility of a daughter, a granddaughter, a niece, whatever you identified with before you said you were a caregiver, if it has just been that familial responsibility, why now is it important to say it is something different? Why can't we just keep it as family responsibility that's not the government's responsibility, that doesn't have anything to do with healthcare? Like, why are we talking about this, Liv? This is what we do in families.
Right, right. And I think that was the attitude for a long time, but it's not sustainable. And that's why we need to talk about it, because we know that three-quarters of caregivers in Canada told us that they are experiencing mental, physical, and financial impacts of care. And fully 20% of caregivers have told us they're not sure how they can go on. They don't know if they can keep doing this. And I think it's really about a better understanding of what care entails, because I'll give you an example. So I think a lot of people think caregiving maybe is making a meal or, doing a friendly visit, that kind of thing. Caregiving is very often very intense. The average hours a day caregivers are doing are 5 hours. And the average length of time someone is caring now in their lifetime is 7 years. So all of our systems, in as much as they even thought about caregivers, because you're right, it was just like something families do. Our systems aren't designed for the fact that people are caring for multiple people over many years with varying intensity. And at the same time as they're trying to hold down a job, care for the other people in their family or their network, do all of the things that bring us a meaningful life. Here is a family issue, but it's also a societal issue. It's an issue for our economy. It's an issue of productivity. It's an issue of affordability. So it's really important to think more broadly about care. I know, when I was caring for my mom who had ovarian cancer, I needed all sorts of system supports that just weren't there. And as a daughter, I wanted to be there for my mom in every way possible. And I was. And I still had to care for my children. I still had to care for my dad. I still had to care for my sister who was going through cancer at the same time. I still had to go to work and do a great job there. And so we know that caregivers are not doing well in this country and that we are critical for every hour of care that happens in our former healthcare system. Caregivers are doing 3 hours of care at home, invisible and unseen. And our system depends on it. This is the other thing. If you've ever had someone in the hospital, you know that when they're ready to go home, you get a printed out piece of paper with some instructions to provide all sorts of care that you've never given, to manage medications, to deal with all the referrals, to do wound care, all of these things that are not just part of being a daughter, that people need support to do. And people need to know, if we're going to be caring for people multiple times over the course of our life, and our systems are only built for us to care once at end of life, we have a massive mismatch.
So, what is the most common caregiving experience in this country?
So, the most common experience, two-thirds of Canadians are caring for a senior, someone with needs related to aging, someone with dementia, someone who's had a stroke or has a heart condition. And that is, I think, what people think about when they think about care. But seniors are not only receiving care, seniors are actually giving a lot of the care. Almost a quarter of caregivers are seniors themselves. And that means that there's a lot of precarity there. We are one fall or one new diagnosis from a whole household collapsing.
Yeah, a whole household collapsing. I just want people to think about that. The precarity of seniors caring for other seniors
Yeah.
and what that means when something goes wrong.
Yes. And the inevitability is something will go wrong. Like it's not a maybe, it's just part of that journey. As we age, things shift, things change, and we can't depend on a country as a country on our seniors to be doing all the caregiving with no support. You know,
So, can you outline what some you kind of intimated earlier, Liv, but I just want to dig a bit deeper because I think you're right in terms of what people think caregiving is. Oh, it's like making some meals, it's dropping in, it's making sure they have their taxes done. But oh my goodness gracious. I think we have to be really specific about what caregiving responsibilities often look like for people. So, can you pull back the curtain for us on that, please?
100%. It is multidimensional. It is everything from that very intimate care of lifting someone who has mobility issues, of doing toileting and that intimate care. It's also all of the care navigation, faxing all of those different offices, tracking down blood tests, talking to the pharmacist, Googling at 3 in the morning when a new symptom has appeared and you don't know how to manage it. It's pain management. It is also about quality of life and making sure that your loved one is still connected to their church, their synagogue, their mosque, to their circle of friends, because we know that for both the caregiver and care recipient, that social isolation is really hard. It's a lot of driving and transportation and going from appointment to appointment. And it's a lot of time missed from work and from your own family responsibilities. So it's multidimensional. It really is something that caregivers are thinking about 24 hours a day. So it's very hard for caregivers to have predictability. And it's very hard in terms of our stress level. We are always on call.
Yeah, and I mean, I just want people to imagine all of the tabs that are open in caregivers' brains
Yes.
around all of those potentials of what could maybe probably at some point will happen and all of the things that need to be managed, need to be taken care of.
It falls on the caregiver because our system is not proactive. Our system is reactive to a crisis that's already happened. So you get care after the fall has happened. You get care after, the person who has cognitive decline has gotten into a car accident and ends up in the ER, or after, the cancer diagnosis has happened. Caregivers have to be proactive. We're the ones who are noticing the signs, and really, there's a huge correlation between caregiver burnout and when caregivers are struggling and when the care recipient is struggling. We are the canaries in the coal mine. So if the caregiver starts to, really struggle, that means that very likely something has shifted in that situation for the care recipient. And when the caregiver is not doing well, the health outcomes for the care recipient are 63% worse. Um, so it's critical to support caregivers. It's also about the system and the economics of it. If the caregiver's not doing well, then we know that's where those fractures and fragmentation in the system are.
Okay, so I want to know when you say the system, we hear the system on this podcast a lot. Is it the healthcare system? What is the system, Liv?
So, you know what caregivers discover? We don't have a care system at all. So you assume, if you're caring for a parent and let's say they're diagnosed with vascular dementia, we assume, okay, now there's going to be a clear pathway. Someone's going to tell me what I have to do to support dad. Like that's going to be clear.
I'm sorry, are you talking about me right now?
I'm talking about me, but I guess I'm talking about both of us because that's it. We just assume Canada's a country that has a healthcare system. What we have is an acute care system. We have a system for, those acute events. We don't have a care system. It falls somewhere between our healthcare and our social care. And the care system is unpaid caregivers. We are filling in that system and we're doing it, on a wish and a prayer because there is no system that is integrated, that is guiding us as we move through this. It's all on our shoulders.
Is this the mandate ultimately of the Canadian Centre for Caregiving Excellence to create a caregiving system?
Yes, we have worked with caregivers across this country and policymakers and researchers and agencies to say it's time to stop expecting people to white knuckle it and to be resilient. It's not only, not a reflection of our Canadian values, it's simply not possible anymore with our change in demographics, with the rising aging population. We can't have no system for families. So that is what led us to work with people over the course of 18 months to co-design a national caregiving strategy that shows very clearly what is it that would make a difference for caregivers, what can governments do, and what can civil society partners do to put together this system.
Okay, so you are talking to me. You're on the heart of it all. This is a podcast all about, we say it every week, the realities of caregiving. I am on side, but I'm going to ask you to do something that you're probably going to hate to do. Sorry, we do this on the pod every once in a
I
while.
love it.
But what is because it sounds like, of course we need to do this. Of course, this is who we are as Canadians fundamentally, and also what we need as a society to have a healthy and fulfilled and prosperous community. But
Mhm.
what is the pushback, Liv, in this caregiving strategy?
It's two things. First of all, it hasn't been on the agenda. So it's not that there's been a but, it's just been like, well, families are doing that. As we talked about a little bit before, just the assumption that everything's fine and the status quo is okay and families will continue. When we know that already 20% of people who are caring have told us they're not sure they can go on, when we're already seeing people, bringing mom or grandma to the ER and saying, I can't do this anymore. I have no support. I can't pay my rent. I can't afford the time I'm taking off work. I love my mom, but I have to surrender her. I can't do this. So we're seeing those alarming numbers. The other thing we sometimes hear is, well, yeah, like why should government pay for this? This is a family problem and, why should government be involved? And on a macro level, we can't afford not to as a country. When we have, almost a third of our workforce now is juggling work and care, and that is hitting our productivity really hard as a country. We are collectively $1.3 billion poorer as a country because of this. So we see people leaving the workforce who we need in the workforce, and our tax base is smaller than it should be.
What about folks who say, okay, I'm empathetic. I hear what you're saying. This is really difficult, but you just have to put your loved one in a long-term care home, a retirement community. What about that pushback?
So that is actually so much more expensive. If you're looking at costs, if that's the lens you're looking through, it's $900 a day for people to live in assisted living. Supporting people to age in place is around $100 a day, if that much at most. So we are building long-term care homes because we haven't made it possible for people to support their loved ones to stay at home with their family and their community. And we know that 90% of Canadians have said they want to age in their community. They want to age at home.
96% of Canadians over the age of 65 say they want to age in place. I say it every week on this podcast because the number is astonishing.
It's just, and you know what actually makes me really, what I think is tragic about that number, it's not just that they want to, they expect to. The average Canadian who's aging thinks that they are going to age at home. And that is not the future state for the vast, vast, vast majority of Canadians because we haven't planned for that. most people are not going to have the aging experience they expect and want to have. There is no aging in place without caregiver supports, period.
Okay, let that sink in, folks. Y'all want to age in place? If we are not coming up with policy and support in this country, that is simply not going to happen. Is that what I'm hearing?
That is 100% what you're hearing.
So, Liv, all those unpaid caregiver hours, do we have a dollar figure of how they are supporting our healthcare system?
Okay, I'm going to blow your mind with this number because it's enormous. It's $97.1 billion a year that unpaid caregivers are doing. And that is larger than our mining sector. That's larger than our banking sector. Like, that is a huge part of our economy that's totally invisible. It's all of those unpaid hours, those tasks that caregivers are doing that are propping up our healthcare system entirely.
So, things are bad. We have a caregiving crisis. We've never asked these questions before. How quickly are we moving? How quickly are people starting to understand what the problem is and how it's going to affect them?
I think we really are at a moment in this country. There is a growing caregiver movement. We've had 35,000 people in the last few months reach out to their MPs, their MPPs, their MLAs to say, this is important and I'm not able to function. Like, I need the government to step in and to take a leadership role. And we know from our survey that actually care issues are in the top 3 issues on how people vote across all political parties in Canada. And we know that we have a huge gap there because people are saying, this matters to me. This is important to where I park my ballot. But at the same time, 2/3 of caregivers in this country have said, I don't feel supported by my government. People feel left behind. And we really need to draw our government's attention to this huge and growing constituency.
So, is this a government responsibility or is it a private practice employer responsibility in terms of benefits and what we offer employees?
Yes, yes, and yes. It's a whole of society issue. The caregiving years for most people are also their prime working and earning years. And these are, caregivers are sitting in your C suite, they're sitting in your senior management roles, they're sitting throughout your organization. So there are some Canadian employers who have already started the process of identifying and supporting caregivers, looking at employee resource groups for caregivers, looking at their benefits packages and saying, what do people need? And I'll shout out our friends at SE Health, which is a large healthcare employer. They actually employ care providers, personal support workers, 85,000 of them across the country. And a really innovative thing they did, they discovered that most of the people who were working as personal support workers were going home after their shift and caring for someone in their own life. And they said, you know what? Our people need support too. And they're giving their staff 10 hours of personal support work as a benefit. I think that really is an amazing way to approach, this holistic experience of caregiving that we're all going to need respite care. We're all going to need personal support care to get our household set up, to get everything we need, all our ducks in a row.
I love that so much. It reminds me of becoming aware of female led companies who gave employees menstruation days, gave
Yes,
employees period days to take off, which was a really big change for women in the workforce. And this speaks to that kind of innovation and recognition of what people's lives look like.
that's it. That's it. If you want to keep your top talent, you need to understand that every Canadian family is going through this. And people are afraid to speak up about it. They're afraid that it'll impact their promotion, their advancement, all of these things. And there's a care penalty. So employers who are real leaders and progressive employers are saying, let's get ahead of this. Let's help people before we get to a crisis point. But it's not just the private sector and employers. It is our health system. It's government. We need leadership across the board. And I think it's important to know that there are whole regions in this country where there are financial supports for caregivers. So Quebec and the Maritime provinces all have income supports for caregivers to help recover that $1,000 a month out of pocket that caregivers are paying for nutritional supplements, medication costs, for incontinence supplies, all the things that you need, equipment, to be able to support someone at home. I had someone tell me that she spent $600 last month on hospital parking fees. I mean, things that you don't even think of that just add up and add up. How are people supposed to put food on the table? We're in an affordability crisis.
You mentioned Quebec and the Maritimes
Yes.
having financial support for caregivers. How complicated is it in this country to affect change about something that is within our healthcare sector, I think, which is provincially regulated,
Right.
and then talk about it from a federal point of view?
You know what? It may not be ideal, but it's totally doable. We already have a federal tax credit, the caregiver tax credit, Canadian caregiver credit, but it's the uptake on it is so limited. It's under 10% of caregivers who are accessing that credit because the eligibility is really impossible. So one of the things the government could do tomorrow is to make that a refundable tax credit that would get dollars in the pockets of caregivers across the country right away. That's already been costed. It's a clear, easy, low hanging fruit policy first step that would help caregivers right away. But we know that it's not just about dollars. It's about mental health supports. It's about targeted mental health supports. It's about respite care. It's about integrated care in our health systems. You know what caregivers tell us all the time is when they get a new diagnosis of a family member, when your family member has had a stroke, you are sitting in the room asking all the questions, writing down all the information, and no one is writing down anything about you. No one is tracking how you're doing. No one is following up. And so we completely miss the needs of the caregiver, which again are critical to the outcomes of that person who's had the stroke. So we are not able to catch when things are starting to become too overwhelming and we're missing the point of intervention. And caregivers tell us all the time, I wish that my doctor would have, thought about me, asked me how I was doing, set up the supports that are out there in the community that I didn't know about. And we hear all the time from people who've been through palliative care at the very end of their loved one's journey that they wish that they had that quality of care throughout their journey. Palliative care offers that sensitivity to the whole family, to the mental health, to the coping that is completely absent from the rest of our system. Again, we have a system that responds to acute care and not to what happens when you leave that hospital door and head home. I mean, we're already seeing it. So in the United Kingdom, caregiving has been declared by the National Health Service a social determinant of health. So the very fact that you are a caregiver is an impact on your health, not just the health of the person you're caring for. We know that caregivers, because of the stress and strain, emotional, physical, financial, have worse health outcomes than non caregivers.
So, at the risk of being repetitive here, what has changed? Is it a demographic thing that has changed? Why all of a sudden is this a global society issue?
One of the things that has changed is absolutely the number of people who are aging. It has really revealed the fissures in our system, all the cracks in our system. But also COVID, for the first time, many people realized what caregivers were doing when caregivers weren't able to be part of that process in long-term care, in hospitals. We realized how much caregivers were actually doing, and we saw the horrific results when caregivers were not able to be involved.
I also question how much our very strained healthcare system is now asking and relying on unpaid and untrained home
Yes.
caregivers to provide actual medical attention. Is that happening, Liv?
It is happening across the country, and it is terrifying for family members. Again, you leave the hospital, you get a discharge printout, you don't get training in how to safely lift someone, how to safely manage their wound care, even to the extent of the things that you're talking about. There's no training at all. And we have caregivers getting injured. We have people who are receiving care in peril, and we also know that not every caregiver is equipped to do these things or even, forget wants to, has the capacity to. So the downloading in our system onto families has gotten extreme. It's not just, tracking test results and managing medication. We're talking about giving complex nursing level of care, and people cannot do it. And I think that's one of the reasons 20% of caregivers have said, I don't know if I can keep doing this.
You first did this study in 2023. Did you see any improvements between those 2 years and the data collected?
I wish I could say we saw wide improvement. What we have seen is that caregivers are more likely to identify as caregivers, again, because they're hitting those barriers and that crisis that turns you from saying, I'm a daughter to, oh my gosh, I have a more complex role here and I need help. Unfortunately, we're not seeing any improvement in the mental health or physical health or financial outcomes for caregivers. Things have gotten worse, significantly, statistically worse. And we're now in a perfect storm. What we see is three-quarters of caregivers are dealing with these impacts, the negative impacts of care. And three-quarters of those paid care providers have thought about leaving the field in the last year. I mean, there are some parts of this country where you can't find a personal support worker for love or money already. And if we have three-quarters of our paid workforce thinking about leaving the field because they're undervalued and underpaid, in some cases they could walk down the road to McDonald's and get a similar or better pay that doesn't involve toileting, lifting, putting their personal health at stake. We really are in an inflection point in this country. And if we don't act, we're going to see more and more costs, more and more people who are vulnerable not getting the care they need, and our ERs are going to explode.
How much does the war on immigration affect our personal support worker population, Liv?
It really is an issue. A lot of our care providers are migrant care providers or here on a temporary status working towards a permanent status. And when we are putting in these quotas on immigration, we're not differentiating the way we need to about who we need in this country. We know we have great Canadian citizen caregivers, and we know we need a tremendous injection of caregivers from overseas to come who are trained, who are ready to do this work, and who are looking for a pathway to permanent residency so they can stay in the field.
And I will add to that, frankly, societally, culturally, look at aging and caring for our aging population differently than North Americans do.
Yes, and across the board, I really want to emphasize these are skilled jobs. We devalue them. We think of them, often people think of them as entry level jobs or stepping stone jobs. They're actually very skilled jobs. It is not easy to lift somebody safely, to do all of this medical care. And families depend on these folks. When my mom was dying, her personal support worker became part of our family. We're still in good touch. Those bonds are there. These relationships on the individual level are absolutely rock solid. And we are not understanding that at a systems or society level. These people are people we absolutely depend on, and they're the bedrock of our healthcare system.
Was there a top line understanding from this Canadian caregiving survey that you and your organization conducted that is the main takeaway, Liv?
So here's your takeaway. We can't continue the way we are. Caregivers can't and won't do it. We have more and more solo seniors, seniors who are aging with no children, with no one in their network who's going to take care of them. And we have a workforce crisis where our personal support workers and disability support professionals are leaving the profession. We have a massive shortage. We can't keep going this way, and we don't have to. The solutions are really clear. Caregivers across this country and care providers across this country have come together. Aging, disability, illness groups, we've had more than 85 national and provincial groups endorse our national caregiving strategy because it's a really clear pathway to get us out of the ditch that we're in and on the road to better supporting families in this country.
I end this podcast with the same question week in and week out. How can we better support caregivers?
So, on an individual level, be aware of who in your community and who in your family is doing the caregiving. Show up with that meal, show up with that open arm to say, I'm here to do laundry. I can make calls. My sister is dealing with breast cancer. I am captain of Team Rory. So I am managing the meal trains. I am making sure that she is never at an appointment alone. And I have a wide network of people who are helping me with that. So on an individual level, be aware. And at a policy level, we need to adopt the national caregiving strategy so that caregivers get the respite support, the mental health support, and the financial support to continue to hold up our healthcare system.
Liv Mendelsohn is the executive director of the Canadian Centre for Caregiving Excellence. They have conducted the Canadian Caregiving Survey. Where can people, if they want to dig deeper, where can people find that survey, Liv?
We want you not only to read the survey at canadiancaregiving.org, but to send a copy to your MP, your MPP, your MLA. If you need help to do that, to set up those calls, to go to those meetings, we have an advocacy toolkit and our staff are here to go with you. We want to know that this is going to reach MPs from their constituents. So don't be shy. We are here to help you.
Amazing. We're going to put all that information in our show notes so people can easily reach out to you through our show notes here on the Heart of It All. Liv, thank you so much for everything you're doing at the Canadian Centre for Caregiving Excellence. And thank you so much for being on the show. Next year, we're going to have better news, right?
We better. We really have to. It's not an option not to. And Teri, I just want to take a moment to thank you. You have shined the spotlight on these issues in the most profound ways, and your podcast is absolutely making a difference. So it's an honor to be a guest with you, but I'm also a listener and a fan. And we know that we need people like you to take this leadership and to shine the spotlight. So thank you.
Well, thank you very much. It truly is my pleasure. It is the most important thing I've ever done in my life, I think, Liv. So thank you very much. Whew, a lot of those numbers are sobering, but we cannot address these issues, just as Liv said, without identifying them. Thanks so much to Liv from the Canadian Centre for Caregiving Excellence for being here and breaking down the report. And thank you for being here week in and week out. We do drop new episodes each and every Tuesday, and we do love hearing from you on our socials. At the Heart of It All Pod, that's HART, is where you can find us on all of the platforms. Jess and Carrie from 6 of 1 Digital are the wind beneath my wings, producing this with me from day one. And thank you for being here and building this community. As always, please take care.